How can we treat refractory anhedonia? Well, what do I mean by refractory anhedonia? It effectively means a low flattened mood that is not responding to any of the existing treatments. This was a question that was asked by one of my viewers in response to another video that I had made with a very common presentation in fibromyalgia, that is anhedonia, meaning lack of interest or low mood. This is something that I would preface first of all by saying I'm not a psychiatrist, so this is not something that I would be suggesting to you that what I'm going to talk about is the absolute gospel. You still do need to be reviewed by your psychiatrist or mental health specialist to help you further. But I do see a lot of patients with this kind of presentation where they've tried a number of things and they have the coexisting problem of worsening pain or fibromyalgia flares, and in that context this is how I'd approach patients with anhedonia that is refractory to treatment. We have to first understand that we are discovering a lot more about the neural circuit changes in conditions like anhedonia. While there is a school of thought that thinks about these conditions as a purely psychological phenomena, we are discovering that there is alteration in the way dopamine has a reward chemical. The release of dopamine in a variety of neural circuits is affected. And indeed, we are now considering that in conditions of refractory anhedonia, we may be looking at a dysfunction in some of the nerve circuits and pathways in the brain where the reward pathway especially is impacted. So the release of dopamine or the modulation of dopamine in these reward pathways is affected or changed, and that is what presents as very refractory anhedonia. So what's important to explore in this? Broadly, there are a few ways to do this. Firstly, it must require a thorough evaluation, a history, a proper look into what might be the various contributors to anhedonia, the social factors, the cognitive issues, and more importantly, any overlapping or coexisting drugs that could be contributing to this problem of anhedonia not being resolved. Especially if you're on other overlapping medication that reduce the amount of dopamine like SSRIs, then that means it could contribute to not having enough dopamine and the reward pathway not functioning. So history, looking at other factors, is very critical. Once you've done that and you've done a good evaluation piece and understand the history, what are the possible newer approaches and treatments that are looking at changing the reward pathway? If we understand it from that perspective, then we realize that while drugs are useful, we really are looking at a variety of nerve circuit retraining options and ways to rewire the pathway, as it were, to enable more dopamine sensitivity. So in that context, a number of lifestyle medicine based approaches focusing on ensuring on hydration, nutrition, sleep optimization, movement practices are critical. And the important thing is that these must be done, or at least the evidence suggests that they need to be done on an extended basis, at least 3 to 6 months, for neural pathways to rewire, form new, and be established. So that's the important thing to remember, that you have these lifestyle medicine pathways as a foundational base which has to be done for an extended period of time. Layered on that would be other neuromodulation approaches. Now these can be, for example, the non-invasive neuromodulation approaches such as cognitive behavioral techniques, a variety of behavioral approaches that use traditional psychological methods to retrain the circuits. So that could be the next layer. Then we have the more interventional reframing and neuromodulation approaches. There's evidence that repetitive transmagnetic stimulation, so RTMS, or TDCS, so transcranial direct current stimulation. We are looking at maybe even more invasive options such as DBS, deep brain stimulation, or electroconvulsive therapy, ECT. So these would be the more interventional neuromodulation approaches to retrain or reset the electrical system. So that is one layer to be considered. On top of this, if we need to, that's where the utility of other drug-based approaches could be considered. What are the drugs that could be looked at or explored? Well, there is suggestion that looking at various dopamine agonists, so drugs that actually improve the amount of dopamine externally, could be looked at. So there's examples like bupropion or pramipexole. There are options wherein you try to use the glutamate system, so modafinil-like drugs could be considered there. There's options to look at other atypical medication. For example, aripiprazole has been looked at in this context there. And finally, you're looking at the use of anti-inflammatory medications, even simple anti-non-steroidals. But this is where nutritional approaches, the use of omega-3 fatty acids, or the use of other dietary supplements could all help in improving dopamine sensitivity. It's important to understand that all of these drug approaches are best discussed with your mental health specialist or psychiatrist, who can help decide whether these are options to consider. But for all the other aspects there, these are techniques to be looked at. Consider refractory anhedonia as something of a mesolimbic, meaning neural circuit dopamine changes, and that's what you're trying to restore sensitivity and change. I hope this has been helpful and you found this video useful. I look forward to seeing you in the next one. Thank you for watching this video. I hope you found this of value. Don't forget to hit the like button and subscribe to my channel for more videos on the understanding of pain science and lifestyle medicine.